RSV Academy. Questions about RSV. RSV vaccines for adults: why, when, and how?
RSV in adults is a significant cause of serious medical illness. The illness can range from a cold to a respiratory failure, and a significant number of people end up hospitalized or even die each year. And so we now have some approved vaccines, and we need to think about who are the highest risk individuals and who we should be recommending the vaccines for. The vaccines have been approved for people over the age of 60, and there are the recommendations that it be, at least in the US, shared decision making about who should take the vaccine. And so I wanted to talk about, who are the highest risk groups and who should really consider making use of this vaccine. One of the most important factors is age. So I said that the vaccines are approved for people over the age of 60. And I always like to say age is just a number, because I now have a lot of gray hair and I am over the age of 60. But if you are an extremely healthy older adult with no underlying medical conditions and you're very active, you're probably going to do just fine with your RSV infection. You may have an unpleasant illness, but it probably isn't dangerous. When we think about age, even though I think age is just a number, there seems to be a bit of an inflection point that although the rates over age 65, hospitalization rates significantly increase, that if you look at decades of life, 65 to 74, 75 to 84, and greater than 80, it really seems to be over the age of 75, things really accelerate. So if you're healthy and you're just older, it might be reasonable to consider waiting until you're a bit older. So on the range of 70 to 75. Certainly anybody over the age of 80, I would recommend this vaccine be used. There's some nice data from the UK where they looked at mathematical modelings looking at the estimate of the burden of disease. And they really found there was a significant dichotomy of the rates of infection for people over the age of 75. So I think one could feel pretty good about recommending the vaccine use in that group. And then for people between the ages of 60 and 75, it really is the presence of underlying conditions that would dictate whether or not this would be something to consider. So chronic underlying lung disease, diabetes, and heart failure seem to be quite associated with having a poor outcome if you have RSV. One that sometimes escapes notice is heart failure. Those patients have a much higher incidence of being hospitalized than people that don't have heart failure. There have been some nice multivariable analysis where they looked at a variety of medical conditions, and hematologic malignancies, organ transplants, and stem cell transplants are certainly risk factors for being hospitalized, but those are individuals that we're not quite certain that they will respond well to the vaccine. In the multivariate analysis, COPD, congestive heart failure, having had a stroke, or chronic kidney disease were statistically significant. So we're still refining some of the other risk categories. And then lastly, having a poor functional status is quite important. That is, you're not able to really take care of yourself, usually due to accumulating underlying disease or advanced age. So those are groups in whom we would certainly recommend it. So I'll just finish by saying, why is it not just widely recommended for everybody over the age of 60? And all vaccines carry with them some risk. And so in the big trials, there were rare events of neuroinflammatory disease, things like Guillain-Barré. They're so rare that it's hard to know whether they're really real, because in this age group, the baseline incidence of Guillain-Barré increases. So are they really elevated, or was it just a chance occurrence? And we don't know yet. And so we just need to balance. All of life is risk benefit. So you look at what is the risk of getting hospitalized, and we all know that hospitalization is terrible for older people, versus the risk of the rare event.